Okay, so the perineum is this piece of skin between the scrotum and the anus, which is there. On the scrotum, the tunica vaginalis, I'll show you when we get to the chart, also in the book, APR. The testes, that's this. Everything there is going to be either on the chart, APR, or book, until we get to the spermatic cord, which actually that will be on the chart also, because you can't see it here. But if you imagine this tube wrapped up in an outer covering, that's the spermatic cord. I'll show you when we get to the chart. This tube right here is called the ductus deferens. These blood vessels are the spermatic arteries and veins. And then the ductus deferens in the back, as it goes behind the bladder. This is the bladder. Here's the ductus deferens getting a little bit larger. That's called the ampulla. And then it empties into the ejaculatory duct, which is going in through the prostate, which is this right here, so inside the prostate. The seminal vesicles are these on the back of the bladder, right next to the ampulla, and they share the same ejaculatory duct as the ductus deferens. Prostate, like I said, right there under the bladder. There it is from the inside. The bulbourethral glands or the Cowper's glands, I'll ask that on APR in the book, but they'd be right here in the urogenital diaphragm, which is this muscle. So they're right here on either side of the urethra, which is this tube. For the penis, this is glans penis is here. The prepuce would be a foreskin. The chart has one. This does not have the prepuce. If you look inside, the corpora cavernosa is this purple, and the crura is the base of that. The corpus spongiosum is the red. The bulb is the base of that. The epididymis is this, right on top of the testes. And the inguinal canal is where the spermatic cord goes in through the inguinal ligament into the body. For the urethra subdivisions, remember this is the urethra. Where it goes to the prostate, it's the prostatic urethra. Where it goes to the urogenital diaphragm, it's the membranous urethra. Where it goes through the corpus spongiosum, it's the spongy urethra. And then the opening to the outside is the urethral orifice. So you guys want to do the chart?